Welcome to this informational video about upcoming COVID policy changes. My name is Liz Dottie and I am the Health Manager for Izzi Early Education. These policy updates will be effective February 5th, 2024 and apply to all staff and all children. I'm going to help walk you through the updates to our COVID policy. So the first change is that we're going to be reducing the negative COVID test requirement for return to one test rather than two, and only needed to return after severe symptoms. Those severe symptoms are severe cough, inability to swallow from severe sore throat, difficulty breathing, and fever. Remember, fever is defined as 100.4 degrees or higher. We are reducing the symptoms list to align with CDPH, the California Department of Public Health guidance, which essentially brings us back to our regular sick policy pre-COVID. The last main change is we're going to be removing the exclusion time period for symptoms. We will no longer have the 10-day, but rather we will be monitoring for symptoms and returning when those symptoms are resolving. So now to walk you through some general updates and policies for our COVID policy. When to keep your child home from school or childcare. Below are guidelines for when to keep your child home when they are not feeling well. Contact a healthcare provider if your child needs medical care. A doctor's note is required to return to school or childcare if out for 3 or more days. For more information, you can visit the California Department of Public Health guidance page. So if your symptom is overall not feeling well, you stay home if any new illness or symptoms prevents a child from participating meaningfully in routine activities. For fever, stay home if a fever is 100.4 degrees Fahrenheit or higher. Return when fever has not returned for 24 hours without the use of fever-reducing medications such as Tylenol, Advil, or Motrin. And a negative COVID test is required to come back after a fever. Vomiting. Stay home if vomiting has occurred 1 or more times in 24 hours. May return when vomiting has not occurred for at least 24 hours and your child is able to hold down liquids and food, and we recommend frequent hand washing. Diarrhea. Stay home if your child has at least one abnormally loose stool in 24 hours. If the stool looks bloody or black, seek medical attention. Return when diarrhea has not occurred for at least 24 hours. We recommend frequent hand washing. Sore throat. When should my child stay home and when can they return? It is okay to attend with mild symptoms. Please consider wearing a mask if your child is of the age of 2 or older. Stay home and seek medical attention for difficulty breathing or swallowing or continuous drooling. Return when improving. If an antibiotic is prescribed, take the first dose at least 24 hours before returning. A negative COVID test is required to return after having a severe sore throat. Cold symptoms such as cough, stuffy runny nose, and sneezing. It is okay to attend with mild symptoms. Please consider wearing a mask if age 2 years or older. Stay home and seek medical attention for severe symptoms, including a bad cough, difficulty breathing, or trouble catching your breath or wheezing when not controlled by medication, like albuterol. Return when improving. If your child will need medication after returning, contact the site to let them know. A negative COVID test for return after severe cough or difficulty breathing is required. Ear or eye irritation, including pink eye. It is okay to attend with mild symptoms. Stay home and seek medical attention if eye drainage is white or yellow, or eyelid or ear is red or painful. Return when improving and cleared by healthcare provider. Rash. It is okay to attend with mild symptoms. Stay home and seek medical attention if rash is worsening, causing pain, has blisters, or is not healing. Return when improving. or as guided by healthcare provider. In general, for conditions such as lice, impetigo, ringworm, scabies, and pinworms, your child may return as soon as they start appropriate treatment. Again, to reiterate, a negative COVID test is required for the following symptoms: fever, severe cough, severe sore throat, or difficulty breathing. If you have any questions, please contact your family services specialist at your site, or you may contact the health services department at Izzi Early Education. Thank you.